The CDC is updating its childhood immunization schedule. It's recommending now fewer vaccines despite the opposition of the American Academy of Pediatrics. Under the new guidelines, the CDC will continue to recommend vaccines for 11 diseases, including measles, mumps, rubella, and chickenpox. Other vaccines will be recommended for high-risk groups, and immunizations for certain diseases like the flu and rotavirus, those will now fall under decision-making between patients and their healthcare providers.
We are now joined by Dr. Stephen Turkovich, the president of Golisano Children's Hospital of Buffalo, to talk more about these new recommendations. Doctor, thank you for joining us.
Thanks for having me.
There are a lot of probably questions, especially for parents of young children right now, because they don't know which guidance to follow, who they should follow, what's going on, what changes, when these changes take place. There are a lot of questions that are flooding into our newsroom, Doctor. What are you hearing right now?
Well, yeah, I do believe that there's a lot of confusion. There's some mistrust out there, but the answer is actually quite simple. The American Academy of Pediatrics, us here at Golisano Children's Hospital of Buffalo, the New York State Department of Health, all of us are recommending that we continue with the previous set of recommendations, and that is we don't believe that these recommendations that they are changing are appropriate and are safe or really evidence-based. So at the end of the day, the answer is simple. Go with what we used to do. That will keep us the safest.
As you mentioned, evidence-based, there's not really new, specific data out there that is saying you should not get these specific vaccines. Senior health and human services officials say the changes are meant to, quote, restore trust in public health post-COVID. What are you seeing in terms of trust on your side with the medical industry? Are people coming in and they don't have as much of that trust since COVID, Doctor?
Well, I think, it's really challenging because there's a significant amount of misinformation out there. There's misinformation on social media. There's sometimes misinformation coming from governmental sources. It's causing confusion. And some of this is very complex science, so it's difficult for people to navigate all the information that's coming at them. It's really our job as healthcare providers, and specifically your pediatrician, to help you sort through the risks and the benefits and understand what you are agreeing to. The informed consent is something that we've always agreed to, we always believe in. I think those conversations are really important. But at the end of the day, the answer again is very simple. These vaccines are safe, they're effective, and historically we know they have saved lives.
Doctor, you said something in your first answer I think that is critically important. While these recommendations are coming down from the national level, they are nothing more than those recommendations because, in fact, these decisions rest with the states. So even though the recommendations from the federal level are for the 17 vaccines to now go down to 11, the state must make that decision as well in order for that to be the rule of the law here in New York, correct?
That is correct. New York State and many states have mandates for what vaccines you have to have in order to attend school. That is something that, as you said, is done by the states, and we will obviously work with them. I don't believe that the state has any plans to change any of those recommendations.
I know you're not an insurance carrier, but I am hearing that insurance will still continue to cover all of these shots. Is that what you're hearing as well, Doctor?
I am hearing that as well, and honestly, it would be very smart for them to do that. When you look at some of these vaccines, the rotavirus vaccine prevents about 50,000 hospitalizations for babies every single year. The flu shot we know prevents hospitalizations, especially critical hospitalizations. RSV, which many times we're on this program talking about, we have seen an 80% drop in RSV hospitalizations since the vaccine took place. So, it's good for babies, it's good for families, it's good for insurance companies.
I imagine, Doctor, I remember when my children were very young and the questions that I had, especially, that my wife and I had at doctor's appointments were varied and vast. I guess right now, when parents come in, what should they be asking their physician? Because we continue to say, have these conversations with your healthcare provider. What kind of questions should they be asking to ensure the safety of their child?
Well, it really starts with the risks and the benefits. So what are the benefits of the vaccine? What is the disease that it's trying to prevent? What are the complications of that disease that could happen? And how often do the complications occur? And then what are the side effects? Many times the side effects are fever for a day or so, soreness, redness, maybe a little bit of sleepiness, sometimes like flu-like symptoms for a day or so, and really understand how often those things occur. And then, are there any severe complications of the vaccine? Those are very, very, very rare.
I know you're not really changing anything that you're recommending, doctor, but because the CDC is recommending this, do you foresee more illness in the future potentially because of this?
Unfortunately, yes. And we've seen that with the measles across the country. And every day we hear about a new outbreak. We have more measles cases in this country than we've had in decades. And unfortunately, vaccines not only protect you, but they protect others around you, especially those that are immunocompromised, those undergoing cancer treatment. And so the less that people are vaccinated, the higher their risk is, not only to the individuals, but also to the population at large.
Dr. Stephen Turkovich from the Golisano Children's Hospital of Buffalo had a very busy week this week, hence the Zoom. Doctor, we appreciate you taking a couple of minutes out of your schedule and spending them with us.
My pleasure. Thank you.
Doctor, thank you.